Hello, my name is Lynn Brophy, and I'm a clinical nurse specialist, and I'm part of the team that developed the NACNS Clinical Nurse Specialist peer feedback tool. And I'm hoping to explain to you today how to use this tool. So this tool was invented to help you as a clinical nurse specialist have a conversation with another clinical nurse specialist within your institution, outside your institution, somebody who you consider a peer, uh, to talk about how you're doing and how you're growing as a clinical nurse specialist. And after this guided conversation, you can use the self-reflection and peer feedback to grow as a clinical nurse specialist. Perhaps choose professional goals to work on, look at things that you might handle differently next time you do that type of project, all that kind of thing. Now, the way we've designed this tool is that the person who is going to be reviewed, so let's say that's me, Lynn, I'll write a very brief description or an exemplar of something I've done in maybe the last 6 months to a year in each sphere of influence. So let's look at that. So here's a little tool where I can jot down very briefly. This is much more meant to be a conversation than a very long 20-page document where you write pages and pages about what you did. This is to guide conversation. So I might write here about a project that I did in the patient sphere. Then, so I might give the name of the project here and then put a description of the project here along with outcome data. Let's say I was working on preoperative hemoglobin A1C testing to decrease surgical site infection. And after encouraging people to draw preoperative hemoglobin A1Cs, I found that there was a 50% drop in the number of people who had surgical site infections who had elevated A1Cs before surgery. Let's also say that I found out that there were 3 providers within my division who were not drawing preoperative hemoglobin A1Cs. And maybe my goal for growth would be to approach those providers or work with colleagues on the multidisciplinary team doing this to ask them to please begin drawing these tests. And if they didn't wish to, why? What were the barriers to drawing the tests? And then once I fill out all 3 spheres of this form, let's say my colleague Shelley Brown is my peer who's going to be giving me some feedback. Well, I can send this to her ahead of time, and the reviewer can read it before our in-person meeting. And at the in-person meeting, Shelley can give me feedback on this project. And she might say, Lynn, another way that you could approach this barrier that you've got, which is not having 100% compliance with providers drawing hemoglobin A1C, could be to do XYZ. And then when I sit down with Shelley in a private place to discuss this form, so I've sent the form to her beforehand where I've written down my information here. And then during our discussion, Shelley gives me feedback. Well, Shelley can write down that feedback here. I can jot down the feedback. It depends on what we figure out. But the bottom line is we're creating a brief summary of what the peers' feedback has been. Now, let's say you've had that talk. This is not intended to be part of the annual performance review. It's just not. It's supposed to be mature peer-to-peer feedback. It's not supposed to be anonymous, that the developing CNS, in this case, it's me, Lynn Brophy, can look at and think about where that person wants to go in the future regarding the project. And in today's environment for CNSs, we of course want to make sure that we're including outcome data on the project. Were there cost savings? Were there cost avoidance? Was there a change in nurse sensitive indicator rates or quality outcomes? It is not traditionally given to the patient's manager. So I do not give the results of this peer feedback form to my manager. It is not part of my evaluation. However, having sat down with Shelley as an expert clinical nurse specialist, perhaps she has more experience than me. Perhaps she doesn't, but she may have very creative ideas about how I can move forward with this project. What I might put in my performance evaluation for that year is I might talk about what I've discovered about myself. I could do a better job measuring outcomes. I need to insert more financial outcomes. I need to perhaps take Shelley's advice and try the novel way of improving this outcome metric. So this is a tool for the clinical nurse specialist to use, not the clinical nurse specialist's manager. Now, two other things to mention about this form, actually three. First of all, I'm hoping that you will talk to your peer about whether they are a member of NACNS. And if not, talk about how important that is to be a member, to have your NPI number, to be counted as an advanced practice nurse in America. The second thing that you need to know is it can be very helpful to refer to the NACNS competency list and for each sphere, and perhaps mention, maybe just by the number so it's not too wordy, what competency was demonstrated, might be more than one, when I did this project in the patient sphere. So that could be inserted into the document as well. The third thing that I want you to know about this form is that it is available on the NACNS website. It's available in the resources section. So you're going to go to resources, you're going to see a peer feedback tool listing under resources, and you're going to click on that. And then NACNS is going to make you feel like you need to pay for that. You've already logged in as a member, and you're not going to have to pay for it, but the transaction feels like you're paying for it, but the total at the end will be zero. So in summary, I'd like to thank Jenny Peterson. Dr. Peterson is at Johns Hopkins and was a co-author for this tool. Thank you, Jenny, for your diligence. I'd also like to thank the NACNS Professional Development Committee, which oversaw this work and supported it along the way. I hope that you will consider using this peer feedback tool. And remember, if you are the only CNS in your system, that is where NACNS comes into play, because if you're a member, you can perhaps identify a peer within the organization that might be willing to get to know you and do some mentoring and peer feedback with you. So I hope you will be able to use this form, and good luck in the future.